YouTube channel HealthQ, the place where my mission is to motivate you to look at the bright side of the health. In today's video, we are going to talk about sensory integration therapy, also called as SI technique. What it is, how it is helpful, where it can be done, and how it helps kids. We are going to understand all of that in today's video. So make sure to watch this video till the end. Let's begin. Friends, children who are suffering from cerebral palsy or who are born with some premature deficit, they are always having some sort of sensory integrative dysfunction, which means an abnormal degree of sensory processing. Sensory integration is a process by which the children who suffer from cerebral palsy or other kind of delayed developmental milestones build and strengthen the connection within the brain, which the normal kids usually develop through the experience of the childhood. Sensory integration aims in helping kids interpret their sensory input, understand its relevance, and respond to those sensory inputs, especially the external stimulus that they experience in their day-to-day life. And these stimuluses are often beyond their control. So, in short, sensory integration therapy helps a child to understand the sensation that he or she experiences throughout the sensory inputs, especially from the external environment, understands how to interpret that sensory input and how to react to that input. Mostly, the kids suffering from cerebral palsy lack the sensory integrative ability, due to which their ability to sense and process and sensory information is either increased or decreased. The senses that are mostly disordered in kids suffering from delayed developmental milestone or neurological deficit are auditory stimulus, or else their ability to hear; olfactory stimulus, their ability to smell; oral stimulus, their ability to taste; proprioceptive stimulus, which means unconscious info obtained by muscles and joint regarding your position in space, weight of object, the pressure felt, the stretch that is felt on the muscle, body movement, and positional changes. The next sensory stimulus that gets affected is the tactile stimulus. Tactile stimulus or somatosensory stimulus, also you can call it as touch sensation. Vestibular process. And the last but not the least sensory input that gets impaired is the vision. Now, every child is different and their ability to process the sensory information is also different. Some child will exhibit increased sensitivity to these external stimuli. Each child would be over-responsive to any small stimulus. Hence, you will always see that extreme noise or else change in the environment or else change in the surface also make them feel anxious, cautious, and scared. There are a group of kids who are sensory seeking. They need more sensory stimulus to understand or to get the feel of a movement or else any kind of sensation. These kids are impulsive and take risk. You must have observed some kids are not just scared of falling or else seeing an object which is very harsh or else something which is hot. Even though they touch, they are not immediately responsive to those stimuli. This is because they are sensory seeking kids. Their sensory input is limited. They need more sensory information to process it and then respond to it. And the third kind of kids are under-responsive kids. These kids are mostly withdrawn. They don't show interest in some activity and they are difficult to engage. Be it any of the category where the child falls into, the sensory integration therapy aims at identifying the category in which the child falls and then tries to help the child with the help of taking activities, games and tasks that allows to improvise on the sensory integration. Developed in 1960s by an occupational therapist, Jane Ayers, sensory integration therapy helps child to achieve following benefits. It allows the child to anticipate action and the outcome of the action, to correctly interpret the sensory input, to create a physical equilibrium and sense of space, to develop a positive behavioral pattern, to eliminate fear, to encourage play and socialization, to lessen the sensory defectiveness, to minimize input intolerance, reduce the negative physical reaction. Sensory integration therapy helps the child to build a mental and physical framework within the nervous system to properly perceive the sensory inputs from the environment, regulate its responses, to understand the significance behind the particular texture, movement or sound. The benefits are not just physical but also are psychological. So, how does a sensory integration therapy is performed? Well, sensory integration therapy is mostly performed by an occupational therapist or as a physiotherapist. Mostly occupational therapists are more qualified to perform sensory integration techniques. The process incorporates proper assessment and thorough examination and evaluation of the child. This assessment does not have to be only physical but also psychological, cognitive. There are a lot of interviews that needs to be conducted with parents as well to identify the proper nature that the child falls into. Either he is hyper-responsive to the sensory stimuli, is he under-responsive to the sensory stimuli, or he is someone who is sensory seeking. This categorization is very important, and this is only possible with the help of thorough examination and assessment. After evaluation, the therapist determines the activities that encourages the child to develop organized responses to the stimuli via different sensory inputs. These activities needs to be practiced in a repetitive and in continuous manner so that the children can learn and retain the process. Children learn how to self-regulate their responses, achieve comfort level with the help of understanding of sensations, and also with the help of understanding how does the sensation work collectively. If you remember in my previous video also I mentioned that body doesn't learn how to do a movement but body learns how a movement feels like. This principle is very similar to the principle of SI therapy as well, where the focus is a lot on the sensory system of the child. For example, a child who is uncomfortable, who is more over responsive and don't like to walk on rough surface or just starts walking on toe whenever he goes on rough surfaces. At that time, the child is encouraged to play with tools and props like grains of rice, sand, so that he gets used to the sensation of rough surface or else rough objects. This in turn will neutralize his or her discomfort with the rough surface or else rough objects as well as the sensation. Like this, likewise, there are many other activities which can be given to the child basis understanding whether he is over-responsive, under-responsive or sensory seeking. Now, where does this SI therapy is performed? Mostly SI therapy is performed at physical rehabilitation centers, hospitals, schools, outpatient clinics, etc. But SI can be very easily and nicely be implemented at home as well. And occupational therapist, physiotherapist and parents are the ones who can deliver this therapy to their child. Hence, it's very important that if your child is suffering from some sort of sensory related issues showing delayed developmental milestone or else any kind of neurological dysfunction, you can collaborate with an occupational therapist or a physiotherapist to identify what all tasks they can do, and you can incorporate those tasks, activities at home for your child. Now, definitely this is not a process which is absolutely risk-free. There are few risks that are involved. There are few precautions that you need to take while undergoing this therapy. First, never start sensory integration therapy without assessment. It's very important to first have an understanding about what category your child falls into. What are his strengths and what are his weaknesses? We don't need to focus on the weakness of the child, but we need to focus on the strength of the child. When a child begins sensory integration therapy and when he receives too much of sensory stimuli, which is for a brief period of time, it can lead to reactive responses, which could be disruptive like willfulness or frustration. Hence, parents, therapists and caregiver must monitor child's reaction and should know how to counteract those reactions. All these situations can be mitigated when a trained therapist implements a highly structured plan of intervention. Sensory integration therapy is a long-term therapy program. It's not just one single type of exercise that fits everyone. It requires a close, precise and a very detailed work, not only by the therapist, by parents themselves. But the good part of the therapy is it's playful. Kids mostly enjoy these kind of tasks and have a very good positive outcome. So, through this video, I try to explain you the basics behind sensory integration therapy. In upcoming videos, I will talk a bit more detail and I'll also try to help you out that how you can apply these techniques at home with the help of basic knowledge and understanding about your child. So, I hope you're liking this series of videos. If yes, make sure to like this video, share this video and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.